Health. We're the only women-founded, women-led birth control delivery, and so excited to do an Instagram Live today. Looking forward to collaborating with Blair Amani and just waiting for her. Here we go. Yay. And awesome. Thank you, Hillary, for joining us. Hopefully, we'll get a nice crowd today. Hey, Megan, great to see you as well.
Hello, hello. How are you doing, doctor?
Good. Nice to meet you. I think I've followed you from afar for many, many years.
Thank you so much. And likewise, I think when you reached out, I got super hyped. So let's talk about it. This is not a telehealth appointment. This is a conversation to talk about everything reproductive health that is going on in the US of A. Usually I say the good old US of A, but things are seeming pretty intense lately. Let's introduce ourselves. You go first.
Thank you so much. My mom said, claim all your titles. So, ladies, claim all your titles. I'm Dr. Sophia Yen, went to MIT undergrad, UCSF Medical School, specialized in kids, and then specialized in teenagers, what we call sex, drugs, rock and roll, a little acne, some sports medicine, and then co-founded Pandia Health. And Pandia Health is the only women-founded, women-led, the only doctor-founded and led birth control delivery. We can deliver to all 50 states if you have a prescription and insurance, thanks to the Affordable Care Act. No copay, no deductible, AKA free. Thank you, Obama, Biden. And then if you need a prescription, it's only $30 once a year to use our expert doctors to get your birth control. We actually came up with an algorithm as a woman of color. I realized what I was taught at the academic institutions, great if you're a Caucasian female that wants to bleed every month. But if you're of Asian or Black descent, I talked to my fellow Asian and Black doctors like, oh yeah, that drug that we were taught doesn't work for us. And I was like, oh yeah, I had to go through 3 different birth control pills until I found one that didn't have side effects. It made me very unhappy. And so being, using my MIT, UCSF, Stanford background, I took all the birth control pills, ranked them. Most likely make you bleed, least likely make you bleed. Most likely give you munchies, least likely give you munchies. Most likely give you zits, least likely give you zits. Took what we learned from those academic centers, fixed it for the side effect that we were seeing in people of Asian and Black descent. And we have 82% retention at a year versus the standard 30 to 55 because we give you a pill that doesn't give you side effects. So
which makes you more likely to want to take it, more likely to want to be consistent. That is so important, especially I think right now where people are a little bit on the fence on whether or not folks have the right to not be pregnant. Folks, as we saw recently coming out of Alabama, I don't know if we want to get into that, about embryos being designated as children. What does that mean? I don't even know if the courts know what it means, because so many of these people making decisions are politicians and not actual healthcare providers, don't have any connection to healthcare. So there's so many things to talk about. I'll introduce myself. Thank you so much for that, doctor. My name is Blair Amani. I'm creator of the viral series Smarter in Seconds. I have a background in history from Louisiana State University. I also have a background in crisis communications, which is the most stressful job in the world. Glad I don't do that anymore. I worked in mental, and I'm getting more involved into, working with a variety of people, but primarily focusing on educating young people about how to have compassion and empathy, and not what to think, but how to think. So a lot of alignment there. I think it is so bananas and so important that you said the first and the only woman-led or woman-founded. Can you repeat that again?
We are the only women-founded, women-led, doctor-founded and doctor-led birth control delivery. The other ones were all founded by a bunch of bros, led by a bunch of bros. They did bring in women to clean it up because they always bring women to clean it up. But who's getting the money at the end of the day? The bros that founded it. So if you want to support the only women-founded, women-led, but more importantly, the only doctor-led company in this space, because I think there's a difference between a CEO founder that has taken the oath, do no harm, and an MBA person who's just there to give you the cheapest pill with the best margins. They're not thinking long-term. I'm thinking long-term, that if I give you a good pill, then it's less likely that you're going to have breakthrough bleeding, that you're going to get zits, that you're going to get munchies. And and then you'll be with us longer, because our goal at Pandia Health is to be with you from 14 years old to menopause, and from menopause until your last breath.
I love that. That's so holistic and that's so necessary. I think there are so few conversations around menopause. I think about my mom, for example, who's going to be 60 this year, who had her uterus removed. I thought it was very sweet because I went with her for her appointment to get her uterus removed. And I was like, oh my gosh, we're getting rid of my first apartment, because that was my first apartment. And basically, not the smallest apartment I've been in, because I did live in New York, just kidding. But it was just so sweet because we went to the same place where she gave birth to me to get her uterus removed. And as I talked about that, and I talk about like, how there's so much diversity when it comes to reproductive health or sexual health. People really don't think very expansively. They're not thinking about older age. They're not thinking about menopause. They're not thinking about women who don't have uteruses, or, women they're really only thinking in this really narrow view that is so Eurocentric and so patriarchal and so harmful. And so I love that angle. I want to take you on a little bit of my birth control journey. And maybe we can talk through, and I get some free medical advice, just kidding, about what went wrong and what didn't. And so I think that there's this expectation when people are on birth control that, I remember I was talking with my cousin, and I saw she was on birth control because I saw her like little package next to the bed. And she's like, I only take that so I don't get acne. I think that's the first thing that's really important, is that like, hey, if you need to be on birth control because you're sexually active and because you don't want to be having kids or be giving birth or get pregnant, that's totally okay. Let's talk about that for a minute.
Yes, I absolutely think that, I think that there's the birth control pill patch and ring, and the patches should have like Nike or should have Gucci. You should like wear it proud in the club and be like, I'm ready to go. I'm prepared. When we do, we're not going to get pregnant here. Like, I'm responsible and I know when and how many children I want to have. So it should be something that you're proud of and something that you're not embarrassed to talk about. And I think we, as people with uteruses, people that can get pregnant, people that bleed, should hashtag stop sucking it up. So if you have bad, evil periods, please see a doctor. If you have menopause,
because you're not supposed to. Let's get into that for a minute, because I have so many friends who are like, yeah, once a month for a week at a time, I'm just completely debilitated and bleeding way too much, and so many folks think that's normal. And I remember, like, so the kind of more matriarchal side of my family, my dad's side, which is interesting because it's from my dad's side. I remember I had period cramps, and they were like, we're going to get you a heating pad. We're going to give you some nice tea. And it was all very nice. But then you have my mom's side of the family, which is like, suck it up. We don't need to do either of that. What we can do is recognize these medical conditions that you're not supposed to have an uncomfortable period. And I remember when I was working in reproductive health, we had to get these pamphlets out to people to remind them that, hey, you can have your religious beliefs, but you should also know that no, your period is not a curse from the Lord and is not the suffering that women are supposed to endure. And I laugh at that, but there are so many people who actually believe those things or who are resigned to that. So let's just start there, because I think the baseline is the ground.
Yes. No, I like to say, just because your auntie bled and suffered, and because your grandma bled and suffered, it's a yen family thing to bleed and suffer. And I'm like, I'm a doctor. I believe in science. I believe in medicine. You should not suffer. And the example I give is that I'm blind as a bat. Do I go around not wearing contacts, not getting LASIK, bumping into walls and stuff? No, I take care of that with medicine and science. I have bad, evil allergies that if I don't do it, I can't walk outside and I'll be, I can't breathe, but do I like suck it up? No, I go see a doctor, I get the medicine, and I take it so that I can breathe and so I can function. So if you are missing work, you are missing school, please see a doctor.
And you have active conversations with your healthcare provider. And I think that's so important too, teaching self-advocacy and how people can speak up. So I think that's something that's super relevant. How would you even get started? Like when it comes to Pandia Health, like for me, for example, because it sounds very fantastic, I'm always having to struggle with my pharmacy about, it's too early to get my birth control refilled.
Yes.
Excuse me, I'm not trying to wait until the day that the last pill is there for me to be able to go and get my birth control. I have a life. I travel. I don't want to have to be beholden to the pharmacy. So that's just me on my little bit of my soapbox. Let's talk through that too.
That's exactly why I started this company, because I was giving a talk to a bunch of doctors. Why don't women take their birth control? And one of the top reasons was didn't have it in her hand, didn't have time to go to that stupid pharmacy every single month. And exactly as you said, it's not the pharmacy, it's the insurance company that puts in the computer, you could only fill this 7 days in advance. And so most of us are responsible and we'll go like 8 days. Like if it's going to run out Sunday, I'll go the Sunday before. And that's actually 8 days in advance and not 7 days according to the computer. So they're like, sorry, the insurance won't pay for it. And you're like, but I'm here today. I don't have time tomorrow. I have work. I have other things. Like, please fill it today. And they're like, well, either you pay for it or the insurance company won't. And so the whole reason I started Pandia Health was set it and forget it. So we worry. You don't have to. We poke the insurance company like, can we fill it yet? Can we fill it yet? Please, can we fill it yet? How many can we fill? Let's fill as many as possible. So that is the whole point of Pandia Health. No one runs out of birth control on our watch to the best of our ability. The other part we need your help as a consumer is if we're not writing the prescription, we write our prescriptions a year's supply at a time. Know that in 20 states, there's a law that if your doctor writes a year's supply at a time, the insurance is supposed to fill it. But I can tell you as a person who owns a pharmacy or runs, pharmacy stuff, insurance isn't following that law. So one, if anybody wants to go after the insurance and sue them, we should. But two,
I'll connect you with my mother because she's ready at all times. She is ready at all times to fight with these insurance companies. But sorry, the second thing you should do is to talk to your doctor.
Talk to your doctor and ask them to write a year's supply. Because as a doctor, I didn't know till I started this company. I wrote dispense 1, refill times 12. And I was like, I gave you a year's supply. What are you complaining about? And it's because I didn't realize I had just chained you to the pharmacy. Because the pharmacy can't expand the prescription. They can constrict it if the insurance won't pay, if you can't afford it, blah, blah, blah. But they cannot go from 1 pack refill times 12 to giving you 3 packs or 12 packs at a time. So you got to educate your doctor that Dr. Yen from Stanford, you can invoke me in that respect, said that in 20 states, you can write a year's supply at a time. And by law, the insurance has to cover it. And so it doesn't reflect poorly on the physician if they write 12 packs, 13 packs, or if you're making #periods optional 17 packs at a time.
Can we talk about that? Because I saw that hashtag as we were talking through things. I mean, okay, so I have, in my life, say I'm traveling, especially recently I was in Australia and I'm staying in Australia with my cousin and I'm trying to do all the things. I'm trying to go hang gliding and go scuba diving and do all types of fun stuff. I'm not trying to have a period, but I have been told that if I don't have my period that all types of ridiculous pseudoscience things are going to happen. But you're literally out here saying periods are optional. Please expand because I'm quite interested.
Thank you so much for asking. And so I actually have a TEDx talk and I'm going to drop it right now in the chat. At the bottom of this page, pandiahealth.com/periods optional is my TEDx talk going over why it's actually more natural not to have as many periods as we're currently having. And so what it is Dr. Beverly Strassman studies the Dogon tribe in Mali, Africa, not like 100 years ago, 50 years ago, but like now. And they die the same exact time we die. So we're comparing apples to apples, not like they die at 30, but they die at 70 or 80, just like we die at 70 or 80. But the difference is because they have 8 children, how many periods do you have when you're pregnant with 8 children? 0. How many periods do you have when you're breastfeeding for 12 months for 8 children, exclusively every 2 to 3 hours? 0. We only have 2 babies and we only breastfeed for 0, 3, or 6 months. And so we have 350 to 400 periods in our lives. They have 100. We're having enough bleeds for 2 or 3 other women. And then I also realized in trying to get pregnant with my first baby that the only reason those of us with uteri bleed every month is we build that lining and we're like, embryo? Oh, no embryo, bleed. And then we build it up again. Embryo? Oh, no embryo, bleed. Every time we build that lining, it can mutate and turn into cancer. Every time we pop an egg and we don't know if it's the popping, the healing, or something to do with the tube, we think it's something to do with the tube, then we risk ovarian cancer. And if you ask a doctor, how do I decrease my chance of ovarian cancer? If they're an educated physician with the latest and the greatest info, they'll tell you, if you go on the pill patch ring for 5 years, it will decrease your risk of ovarian cancer by 50%.
Wow.
The only other way to decrease it is to take out your ovaries, which we don't recommend unless you're around 50 and they're going in to take out your uterus anyway, and they can take it out as well. But by going on the pill patch ring, you decrease your risk of ovarian cancer, endometrial cancer, and then lastly, colorectal cancer. And the way I think of it is your colon is around your uterus. And so your uterus up and down every single month from age 12 to 50 and only popping out 2 babies. The rest of the time, What a waste, right? And the colon's like, oh, I'm sorry for you. And it either runs slower or it runs faster. And if it runs slower, that's constipation. If it runs faster, then that's diarrhea. And anytime you mess with the colon, you increase your risk of colon cancer.
Wow.
And so that's like all the benefits of not having to bleed. So it's actually more natural not to bleed as much as we're bleeding. We're bleeding again enough for 2 or 3 other people. And it's like not necessary. And so particularly vacation, but also life.
Yeah. I mean, I think it's so important. Like I've had friends who told me like there's like hacking their period or whatever it's called, right? Or going with no periods. Oh, okay, if I just start, you can just start your next birth control patch when that. And what y'all, I'm talking to a Stanford educated doctor out here, okay? This is not pseudoscience. This is not some nonsense you gonna hear on TikTok, unless it's her specifically talking on TikTok, in which case it's not nonsense, it's science-based. I want to do a Smarter in Seconds on this immediately. I also want to see an animated television show where you animate all of the different body organs, because that was so engaging and so hilarious and so necessary. But I think the biggest thing is that some people are creeped out about it. I saw a TikTok from a guy yesterday, I think, and it was a guy who was like, I provide pads, I provide tampons because I want to make sure anybody who comes to my home is comfortable, whether it's, you know, a brother, whether it's like a sister, or some brothers have periods as well, but whether it's like my sister, it's my mom, whether it's my auntie, whether it's a hookup, I want to make sure that they feel comfortable. And so I think that's something that's really important, is to normalize, you know, to normalize sexual health, to normalize conversations around it, normalize not having a period, because apparently we don't need to. And I love that. I'm about to change my whole life because that's unnecessary for me at this moment in my life. I'm not trying to have kids. And I spent the whole day with my niece, my 8-year-old niece today. And I was like, wow, I really want to be a mother eventually in the future, because it's expensive and it's also very scary. There's maternal mortality for Black women, very high rates. But I think that, sorry, going back to what I was talking about normalizing conversations about this, how can we push people in our lives who maybe, I'm not trying to get everybody to be on the same page as you, where you so eloquently say, no embryo, time to bleed, even though I'm going to start referencing it that way. But how do we start to break through that kind of fear of discussing periods or discussing uteruses, doing that in inclusive ways? How did you get so comfortable?
I think it's just I love the fact that I'm an older sister to 2 people with penises, you know, and I just like, if I'm going to suffer, the whole world should know about this. And so I'd be like, I have my period. It gives me zits. There's blood coming out. And I think it would be so fun if we were to take on, like, maybe, you know, March is what International Women's Month, and anybody who's an ally would wear a little red uterus sticker. And then we with uteri would be liberalized to throw water balloons with red ink, and we can choose 3 to 7 days in a row randomly that month to just let them experience what it's like to be randomly hit with blood, you know, for 3 to 7 days, because they don't get it. I don't think they get it, right? It's random, and you don't know if it's 3 to 7 days. You don't know if it's going to be a deluge, if it's going to be light. Only with the birth control pill can you get it to a certain lightness, and with the pill patch ring or the IUD or the implant, you can go no periods, #periods optional. But for most people who haven't heard my talk, you know, then you end up with blood 1 week out of 4, and it's just random and just like,
And you're
so
supposed
much
to just
stress.
go around like that's not happening. I think that's the biggest thing. When I first started having my period, and I was about, I was a late bloomer. I have, it's also because I have an autoimmune disease. I have thyroid disorder. I have Hashimoto's thyroid disease. So that made my thyroid later, or my period come later, which I was kind of grateful for. But when it hit, it was like all at once. And it was like, bam, puberty in your face. And I was like, I'm sorry, I'm supposed to just go to school? I'm supposed to just live my life as if this isn't happening? Because it felt like the most intense, serious, worst thing in the world, because as much as my mother was shoving those My Body and Me books, those like sexual health books, because she's 100% a feminist, wanted me to have that education, she gave me one book that was so like descriptive, I gave it back. I was like, I'm not ready for this. Give this to me in another 6 months. Maybe we'll get there. But it was kind of one of those things where it was just too much. And so I think that's the other thing, is that people have to have empathy and understanding for it. That like, even if you just had diarrhea for a week out of the month, every month, which some of us do have as part of menstruating, you'd be a little grumpy, you'd be a little cranky. And I think that's something else to talk about, is the PMS side of it. I think there's more conversations happening around, is it PMDD? Is that the terminology?
Yes. PMS, but there's also PMS. So PMDD is stronger and, debilitating, and PMS is lighter, not yet at PMDD. And then my thing is, if you get rid of the M, then you don't have that. Did you know the number one cause of anemia in a menstruating woman is menstruation? And the number one cause of missed school and work in somebody with a uterus under the age of 25, bad, evil period. So too heavy, a lot of pain, a lot of cramps. And if you have any of that, please go see a doctor and get that treated. And you were asking earlier about, how easy this is to get treated. So come to Pandia Health. We are prescribing in 17 states. We purposely picked the biggest states possible, one, because people travel there. And so we actually encourage birth control tourism. So the example I give is we're not in New Jersey or Connecticut, but we are in New York. And who in New Jersey and Connecticut don't get to New York at least once a year? You just got to get to New York. It could be even a stopover for 1 hour and be like, my foot is in New York. I'm in New York. And fill out our questionnaire, pay our fee. It's only $30 once a year to use our expert doctors with unlimited follow-up questions for the next 365 days.
Cheaper than Netflix or Hulu or any of the other things that don't help you not have a period. First of all, I saw the periods optional. Can you really? Okay, so I have ADHD and it's the end of the day. So I'm really struggling right now, but I'm just so fascinated. I can just have a whole year without a period, nothing bad will happen, but I guess it also depends person to person.
Well, so I haven't had a period for the past 14 years, which is my last child, because I realized the only reason you build that up, you bleed, is you built it, you waited for embryo. Oh, no embryo, bleed. And so after my last child, I was like, I'm not going to make any more children. So why do I need to do this every single month? I'm just going to do smooth, and like you said, each person's different. However, most women can get out to 3 months with no bleed. And then some people, their bodies just really want to bleed at 3 months.
Bodies are like, ah.
Yeah. And so if you're that person, we used to be like, just barrel through. But then we learned, just come off for 3 to 5 days. And on day 4 or 5, your choice, restart the pill patch ring and it'll turn the sucker off. But it will clean and reset. The other part you have to be careful of is who you're around. So if you're around a woman who's every 28 days, that's some crazy strong hormone. She may infect you with your period. And so when my daughters started getting their periods, I was like, you all stay away from me, because I know you are crazy hormonal at that age and you can infect me with my period. And it happened to me because I was in a room with 2 21-year-olds for a week where we slept in the same room. And so their pheromones are coming at me 8 hours a day.
Oh, that's
and
real?
Then I got my period. Yeah. And I'm like a doctor who knows how to take my pills, who hadn't bled for many, many years. And all of a sudden I get my period. I'm like, what the? And then the 2 women next to me are like, oh yeah, me too. And I was like, damn you nubile 21-year-olds, you infected me with your period. So watch out. You got to get your neighbors on it too. You got to get them on the IUD.
So I'm so fascinated. So I used to be a sexual health, reproductive health educator. And I used to do that type of communication and education. I thought that was pseudoscience. Mind you, I'm working in this office, primarily cisgender women, and people would get their periods. And I would be like, and we would kind of joke, who's the most dominant woman in the room? And why are we all syncing up with Liz? Yes. I didn't know that was real. Can you talk, why does that happen? How does it happen?
Well, it makes sense from the animal world that if we all sync together, then our group could have one crazy wild orgy, but also we could then have our children together and protect the babies at the same time, share the breastfeeding, because you don't want babies all throughout the year, because babies are so vulnerable that the pack has to protect them. You would like them synchronized. So this synchronizing is real. I mean, the research has shown that it doesn't quite sync up or whatever, but they haven't taken into account all the factors. And so,
well, I think the other thing is that we kind of know that a lot of research doesn't really revolve around people with uteruses. And if it does, it's really lazy, like saying that, oh, hey, if you have horrible, debilitating periods, that's normal. So it's already just patriarchal to begin with. So I would venture to guess that somebody, if Oprah happens to be listening, should fund some research on syncing up periods, because I think that's so fascinating.
Yes, yes. No, so it's, they haven't taken all the factors in consideration because they didn't ask, were the women on the pill, the patch, the ring, the IUD, the implant? Who in the room, like you said, is the alpha period woman? And the example I give was my MIT dorm room, 3 women, 1 woman every 28 days. Me every 31 to 35 days. The other person with polycystic ovarian syndrome every 3 to 6 months. And we all went to the 28-day lady. So she was the pheromone lady. And then the other example is I have a chiropractor, and she has a receptionist who's on the IUD with hormone and had no periods, but then started working for this chiropractor. And the chiropractor is every 28 days. And so she's crazy fertile. And the IUD lady started getting her periods, and she's like, what's up with that? And it's because she spends 8 hours a day or more with this chiropractor in very small quarters, inhaling her pheromones. And so absolutely
Wow.
connected.
I thought, coming into this chat, I've done my research, I knew my things, but you can always learn more, which is why it's so important to be focused on like people who are on the cutting edge of medical research. And I think that's really important, particularly right now. There's so much kind of American theocracy happening where people are imposing their beliefs and understandings onto other people's abilities or desires to not be pregnant or to have kids or to do in vitro fertilization. We just saw that in Alabama. So I want to close, if that's okay, by talking a little bit about current events and how people can protect themselves or maybe even stay hopeful. I guess we'll start with the embryo conversation in Alabama.
Yes. Well, as you know, Alabama has gone insane, and they've declared that embryos are the same as somebody who's alive and breathing. And as George Carlin might have said, if you're in a building and there is a child and the building is burning down and there's 500 embryos, which one do you save? You save the child, because the child is here, the child is alive, and the 500 embryos are potential. But if they never find a uterus, or if the test tube breaks, that's a totally different thing. They haven't been born, they haven't been birthed, they may not even be wanted, they may be waiting for future, or they may never be used. So I just think it's crazy when politicians try to be hashtag gynoticians, which is politicians who think they're gynecologists or have any understanding of women's biology. We even had, so can't just be a doctor, because there was an ophthalmologist and a surgeon, but they did not understand the uterus, and they were Republicans. It has to be somebody who probably has a uterus and hopefully is a gynecologist, family practice, internal medicine, adolescent medicine, who really is obsessed with birth control and uteruses, and that's me.
I love that. I think one thing that's really important about what's happening in Texas, and I just think really quick about this one politician, I can't remember who it was, but I think it was in New Jersey, who said, oh, why do they need free pads and tampons? Can't they just hold it till they go to the bathroom? Do you remember that?
Yes.
So
that is
like, first of all, no, that's not how it works. Okay. I don't know how to describe a period to somebody who's ever had it, hasn't had it, but for anybody who's ever farted and it was not, and you trusted a fart when you shouldn't have that, but for a week out of the month, every month, it's a mess. But I think about for myself, like, having worked in reproductive health and being a woman of faith as well, I'm Muslim. Like, I think that what's so important about these conversations is that we're not here as people who are pro healthcare, who are pro bodily autonomy to say, hey, an embryo isn't a living being or is, or, because I think that's a really sacred and important conversation for people to have personally. For myself, I had a miscarriage in I think it was 2018, and that was really tough, but I was also, I wasn't ready to be a parent. And it was kind of an issue with the birth control that I was on, interacting with other stuff. I wasn't being consistent on it. So on the one hand, I was very sad and I was mourning that, but I was also happy that I wasn't going to be a parent. And I still have very complicated feelings about that. And I think that what's so important about the reproductive health space is that I'm not required to be on a certain side of a fence about what that entity was, what that miscarriage was about. I can just show up and say, hey, I need healthcare, I need support, I need people to not judge me. Whereas I feel like the conservatives in the American theocracy we're seeing is like, no, that was a life, you should have a funeral, like all these things that are really imposing and really harmful to people's psyche as they're going through life and just trying to get through life. Like, we're out here being told that we shouldn't be sexually active, yet people are sexually active and we want to protect ourselves, and then they're taking away our right to protect ourselves. So that's just me on my little soapbox about that, because I think that that's so important in the reproductive health space. We're not telling you where, what, who, we're just showing you how, safety, care, and for you to make the decisions. We're not telling you what to think. We're showing you how to think, or what the solutions could be. I think that's so important too.
Yes, it's, informed consent and giving someone all their options. And that's what's so scary about these crisis pregnancy centers that a lot of conservative states are funding with our tax dollar money. So if you don't know, there's, crisis pregnancy centers that'll be calling themselves pregnancy centers or real options medical clinic. Sounds very real, right? But if you go there, it's actually a religious institution whose pure job is to scare you about abortion and tell you that abortion will make you sterile, abortion will make you a drug user, abortion will make you go to hell, all sorts of stuff like that. And these are not medical clinics, and they're taking money from Women and Infant and Children's Fund, WIC, and putting it for these centers. So if you are in one of these conservative states, make sure they're not wasting your tax dollars that way. I would prefer that they fund, if someone chooses to continue the pregnancy, low-income women to get their food and their clothing, than these kinds of clinics that are not providing informed consent.
And what we see time and time again, because when I was working in reproductive health, it was when Texas had closed many Planned Parenthood clinics. And there were so many people who were like, Planned Parenthood's this, Planned Parenthood's that. First of all, you've never stepped foot inside of one. Like most people who were saying those things hadn't. And they start hearing about all the services that they provide. But what we saw time and time again was the more education you provide, the more prophylactics, the more birth control options, the more you talk about it, the more you explain to these, horny young people that, hey, this results in a pregnancy, which results in this, the less unplanned and unwanted pregnancies you end up with. It just happens time and time again. In fact, the less abortions, you'll get less abortions if you give more options for birth control and more sex education. So they're kind of being, they're hustling backwards even in their own terms, So I think it's really troubling. But how do you stay hopeful within all of this? Because you just seem like you're so full of joy. I can't wait to have you on many Smarter in Seconds episodes about periods, about period myths, about menopause. So I'm going to be all up in your DMs constantly. But how do you stay hopeful?
I'm hopeful because I know that those that are 50 and under, but also those that are 70 above, are rabidly supportive of reproductive rights. My body, my choice, my uterus, my choice, my body, my religion. And that a fundamental of this country is freedom of religion. And people need to realize that this is not just about, abortion or birth control. This is about freedom of religion, but also freedom of bodily autonomy. And the majority of this country gets it. It's just this fringe politicians that are out of their mind, and we need to vote them all out, and we need to out all of them. So whenever I see a politician, I'm like, where do you stand on reproductive rights? Where do you stand on abortion? Where do you stand on comprehensive sex ed? Where do you stand on adolescents' right to confidential health care? Where do you stand on emergency contraception, medication abortion? And if they don't support my right to bodily autonomy, if they don't support my right to religious freedom and deciding my religion according to my religion, because even people of Catholic faith can differ. There's Catholics for choice, and they state the bottom line is your relationship with God. And if you need to terminate this pregnancy to save your uterus for your next baby, or to be here in this world for your current
there's a theological basis.
Yeah,
and it's the same thing in Judaism, which I was really interested to learn about, how a lot of these abortion bans can also be understood as being anti-Semitic because, and I might butcher this, so if there's any folks to correct me, but basically if it's to save the life of the mother, then it's okay to terminate. And there's also in Islam, it's not considered a life until, a certain till the quickening happens, until there starts being movement within the uterus. So there's all this different religious diversity even within Christianity, within pagan religions, etc. So when people say that it's a matter of God, they're really pushing a lot of things. They're defining God, they're defining life for you, and they're really just taking over your bodily autonomy. And the thing that's so mind-boggling, I remember I was in Memphis, Tennessee, and we were trying to get this, Plan C pills. Thank you so much for dropping that in the chat. There was this initiative we're trying to get to make condoms available. And you recently posted about condoms, so we have to end on that note. But trying to make condoms available to young people to prevent to prevent sexually transmitted infections, to prevent pregnancy. And we had people who respectfully, oh yes, there's the condom packet, we love it. These were people who were well past the time where they would be procreating or even perhaps be sexually active. And they were up there. This one guy, he was, he had to be at least 90. And he was talking about, well, I just don't think that people should have condoms because they should. Sir, go home and think that by yourself. If you don't want to be having sex with people, then don't. I'm sure nobody's trying to hit you up anyway. But it's one of those things like, why do you have so much free time to be able to go down to the Capitol building to be able to talk about these things and then decide for hundreds of thousands of other people that they shouldn't have something because you don't want it. If you don't want an abortion, then don't get one.
Yes.
If you don't, like, it's those types of things.
Yes, absolutely. My whole thing is your body, your choice, your uterus, your choice. Oh, no uterus? Then shut up. My uterus, my choice, your uterus, your choice. No uterus? Then don't talk to me about uteruses. Unless you're here to support me, then I'm into that.
100%. It's all about more rights, not less. Should we end on condoms and then we can wrap it up? Because that's a little pun for all of you listening out there. But I just wanted to say thank you so much to Pandia Health. We're definitely going to be doing Smarter in Seconds very soon with Dr. Yen. But let's end it off with a little bit of condoms.
Yes. So people say, hey, you're married. Why are you carrying condoms? And I was like, well, if my significant other had to leak my secretions for the next 24 hours, I'm pretty sure he would make sure I wore something so that he did not have to leak my secretions for 24 hours. So if not for the sexually transmitted infection prevention, if not for the pregnancy prevention, I absolutely suggest everybody double up, meaning condoms plus hormonal, condoms plus the copper IUD for the sexually transmitted infection protection, but also for pregnancy, you double the two up, you decrease your chance of pregnancy significantly. And for those of us that are not concerned about, contraception per se, or we're monogamous, etc., it's because I'm a physician. I have studied the vaginal flora. It is bacteria and yeast living in harmony. But if you throw alkaline, aka semen, then it messes it up, and then you can get a yeast infection or you can get bacterial vaginosis. So yet another reason to use condoms. And then know that there are different thicknesses to condoms, and there are thinner condoms that give you better sensation. And we actually pride ourselves that we have the best condoms at Stanford Clinic that is rated by condomdepot.com. I don't get paid by them, but I love that they have the penis person rates it this, and the person with the vagina rates it that. And so then we pick the one with the best rating, so that way you get a great experience. You're more likely to use condoms. And then lastly, the condom bag, if any of you want it, we're selling it at Pandia Health. It's $65, and a percentage goes to support reproductive rights.
Absolutely. What a great thing to just have. It's a statement piece. It's great for all the sex educators out there. It's also a dope thing to have the party be the person who talks about, using prophylactics, using these things that protect us and protect each other. So that was amazing. I want to shout out another sex educator. If y'all don't already follow Bottoms Digest, Alex Hall is absolutely phenomenal. And I hope that I'm going to actually connect you two, talking about being somebody who doesn't have a uterus, who actually, has a penis and can be a supporter and an ally. But thank you so much for having me. I hope we can do this again soon. And I can't wait to have you in the Smarter in Seconds. It'll be great for Women's History Month.
Thank you. Thank you. Love meeting you. Love connecting. And yes, everybody, please check out Pandia Health and follow us if you aren't already. And I'm trying to get my TikTok and Instagram up. So Dr. Sophia Yen, I put it in the chat, Dr. Sophia with a PH and Yen.
Awesome. Toodaloo. Thank you.
Thanks. Bye.
Bye-bye.